Let me ask you something. As you've gotten older, have you wondered if the way you take care of yourself, especially your private life, needs to change? If you're a man over 60, you know your body isn't the same as it was in your 20s or 30s. And you might be privately asking yourself, maybe with a little confusion or even shame, what that means for a topic we just don't talk about enough: masturbation. I want to start by saying that this is not only a normal part of life, but it's a healthy and important aspect of your well-being. But the way you approach it does need to evolve. I'm Dr. Peter Whyte, a board-certified urologist, and for over 20 years, I've helped thousands of men navigate these exact kinds of changes. My goal today isn't to scare you, but to give you the knowledge to handle this with confidence, knowledge that most men, frankly, learn the hard way. Here's the deal. Your body's response to touch is different now. Your skin is thinner, the nerves might not be as sensitive, and the blood vessels that make everything work need a little more care. Because of this, I see men making 3 critical mistakes over and over again. These are mistakes that can cause irritation, damage sensitive tissues, and frankly, just rob you of satisfaction. Today, I'm going to walk you through each one and give you a science-backed guide to make sure your private life supports a healthier, more vibrant you for years to come. And before we get into it, if you want more expert advice on men's health and aging well, go ahead and subscribe to the channel. Your future self is going to thank you. Section 1. Why your body's needs change after 60. First off, let's get one thing straight. Self-pleasure is a healthy, natural, and beneficial activity at any age. When it's done right, regular, gentle stimulation is fantastic for your body. Some studies have even pointed to a link between regular ejaculation and a lower risk for prostate cancer. It also helps slash stress, improve sleep, and acts like a form of physical therapy for your entire pelvic region by maintaining crucial blood flow. But after 60, your body is working with a new set of realities. Think of it like a classic car. It's still a beautiful machine, powerful and full of history, but you wouldn't redline it the way you would a new car right off the lot. It just needs a different kind of care and a more mindful touch. So what's actually happening? For starters, your skin, including the skin on your penis, gets thinner and loses some of its elasticity. The nerves that send pleasure signals to your brain can become a little less sensitive, which means it might take more stimulation to feel what you used to. That's a totally normal part of aging. And maybe most importantly, the blood vessels all over your body, including the ones essential for an erection, can become less flexible from things like high blood pressure or the general hardening of the arteries. This can affect your ability to get and keep an erection. This combination, thinner skin, different nerve feedback, and changing blood flow, is exactly why the habits that worked for you at 30 can cause problems at 65. This isn't about loss, it's all about adaptation. And that brings us to the first critical mistake. Section 2. Mistake number 1: rushing the process. The first and most common mistake I see is rushing. In our go world, it's easy to treat masturbation like another task to check off a list. Get in, get it done, move on. It becomes a mechanical habit instead of a moment of presence. After 60, this approach isn't just unsatisfying, it's working against you. When you rush, your body stays in a state of stress. Your nervous system is on high alert, your muscles are tight, and your blood vessels can actually narrow. You're telling your body to perform under pressure, which is the exact opposite of what it needs. The result? The experience feels hollow, muted, and you might feel more disconnected afterward than you did before. I had a patient, a retired military man in his late 60s, who was very disciplined. He told me the pleasure was gone, that he was just going through the motions. It became clear he was approaching this private moment with the same hurried efficiency he used for his daily chores. He was rushing, and his body was shutting down in response. The solution is simple, but it's profound. Slow down. This isn't just about taking more time, it's about shifting your entire mindset. Treat this as self-care. It's relaxation time, not a race. Before you even start, take a few deep, slow breaths. That simple act tells your nervous system that it's safe to relax. When your body is relaxed, blood flows more freely, your nerves become more receptive, and every sensation is heightened. Also, consider your environment. Sitting for a long time on the toilet, for instance, isn't great for pelvic circulation. Give yourself a comfortable, relaxed space. Think of it like sipping a fine wine versus chugging it. When you slow down, you notice the details. Your body has a new rhythm now. Your job is to listen to it, not force it into an old tempo. Section 3. Mistake number 2: using too much pressure or a death grip. This next mistake often comes from a place of frustration. As penile sensitivity changes, some men fall into a trap. They think that more force will create more feeling. This leads to what I call the death grip, using way too much pressure and aggressive force to try and spark a stronger sensation. This is one of the most quietly damaging things you can do. Let me be clear. Your penis is not a muscle you can strengthen with force. It's a delicate structure made of spongy tissue, sensitive nerves, and tiny blood vessels. Applying too much pressure, over time, can cause real problems like bruising, soreness, and skin irritation. While many factors can contribute to it, any kind of repeated physical trauma is a risk factor for developing conditions like Peyronie's disease, where scar tissue causes a curved, often painful erection. More often, it just creates a vicious cycle of desensitization. By using a death grip, you're basically numbing the nerve endings. Your brain starts to need that intense, aggressive stimulation just to feel anything, which makes a gentle, nuanced touch feel like nothing at all. You end up needing more and more force for less and less satisfaction. The solution is to retrain your touch. Shift from a mindset of force to one of finesse. The key is twofold: a gentle touch and good lubrication. First, consciously relax your hand. Instead of a tight fist, use your fingers and palm to explore with a lighter touch. Pay attention to what actually feels good now, not what you remember feeling good. You might be surprised that a slower, circling motion is far more pleasurable than the old rapid one. Second, and this is non-negotiable, use a high-quality, water-based, and unscented lubricant. As we age, natural moisture decreases, and friction is your enemy. Lube isn't a crutch. It's a tool that protects your skin and enhances sensation. It lets you have smooth, pleasurable movements without needing that harmful force. Think of this as a therapeutic massage for one of your body's most sensitive systems. It's about care, not conquest. If this is starting to click for you and you're seeing how these small shifts can make a big difference, do me a favor and hit that like button and subscribe. It really helps us get this crucial information out to more men who need to hear it. Section 4. Mistake number 3: ignoring your emotional and mental state. The third mistake is the one we overlook the most, but it might be the most important: ignoring your emotional and mental state. For decades, men have been taught to see masturbation as a purely physical, almost mechanical act, totally separate from their feelings. Many guys still carry a quiet sense of shame or guilt about it, which can get even louder as their bodies and desires change with age. Here's a truth I've seen in my practice for over 20 years. Your mind and body are not separate. They are deeply connected. Your emotional state has a direct, physical impact on your sexual response. If you approach self-pleasure feeling stressed, anxious, ashamed, or just emotionally empty, your body knows it. The stress hormone cortisol can rise, which gets in the way of arousal and pleasure. You might be going through the motions, but your mind is a million miles away. This can turn it into a hollow, compulsive habit, something you do to numb loneliness or anxiety, not for genuine pleasure. I've had patients describe it as their only moment of connection in the day, which is a heartbreaking sign of a deeper, unmet need. The solution is to practice self-compassion and mindful connection. This just means approaching this private time with kindness. Before you begin, check in with yourself. Ask, what do I really need right now? Is it physical release? Relaxation? Is it just a moment of quiet connection with my own body? Knowing your why can turn a mindless habit into a mindful ritual. Remember, this is about self-care and self-respect. There's no goal you have to hit. There is nothing to prove. Let go of any shame you're holding onto. This is a normal, healthy part of being human. And if you find that feelings of guilt or anxiety are persistent, seeking support from a doctor or a counselor is a sign of strength, not weakness. By embracing this as an act of connection with yourself, honoring the body that has carried you this far, you shift the entire experience. It's no longer just about what's happening below the belt, it's about what's happening in your heart and mind. That is where true, lasting satisfaction is found. Asterisk conclusion. So, when you put it all together, we're talking about avoiding 3 key missteps. Rushing the process, using a death grip, and ignoring how you feel. By slowing down, you honor your body's new rhythm and improve circulation. By using a gentle touch and lubrication, you protect your body and rediscover pleasure. And by approaching this with self-compassion, you transform a physical act into a deeply healing and connecting experience. Rediscovering your body in your 60s, 70s, and beyond isn't a step back, it's an evolution. You are learning what your body needs now asterisk, in this chapter of your life. That is a powerful, dignified, and vital journey. You deserve pleasure, you deserve confidence, and you deserve to feel good in your own skin, at every age. Your body still matters, your pleasure still matters. Be kind to yourself, stay curious, and take good care of yourself. Because no one else will if you don't. This is Dr. Peter Whyte. See you in the next video.